My channel is mostly for my videos regarding infertility, premature ovarian failure, and our experience with the IVF process so far. But today I wanted to make a video talking about how to communicate with doctors and advocating for yourself. I'm going to communicate that with a story of my experience over the past year or so with doctors, not only with IVF, but also with a back pain experience that I had. So just to get into that story with the back pain, that taught me a lot about how to best communicate with the medical community. So I first started remember getting this intense back pain. It was in my lower back on my left side last spring in April, May sort of time period. And I started by going to urgent care, and the urgent care doctor told me, oh, this is probably, you're just stressed from having your wedding planning. So that's what I think you're getting the pain from. I kept getting the pain, so I went to my primary care doctor. She started by saying maybe I was constipated, and then she said, oh, go to physical therapy. I went to physical therapy. They said to work on my core muscles to help with preventing back pain by improving my core strength. My primary care doctor also referred me to a rheumatologist, but it was about a 3-month wait time to get in with a rheumatologist. So while I was waiting for that, I kept going to physical therapy. I also went to a chiropractor, I went to acupuncture, tried a bunch of different things to help with the pain, to no avail. I still kept getting that back pain. It was intermittent, about twice a month or so. No real rhyme or reason. Sometimes it would be, I'd get pain like this twice in 1 week. Sometimes I'd go a month or so without getting it. And most of the time when I got the pain, it was so bad that I couldn't go to work. I was vomiting, just couldn't do anything except for just wait for this pain to pass. And I finally got into that appointment with the rheumatologist, and he told me back pain is just part of being an adult. Like, everyone gets back pain. And I was really frustrated with that response, because I know that the back pain, like what I was having, was not normal. And I just felt really discouraged by his response. He did recommend that I go get an ultrasound done, but I kind of put off doing that. I had the appointment with the rheumatologist in the late summer, early fall, and I put off doing the ultrasound because I was just so upset with what he said. So I did finally go get that ultrasound though in January of this year. And he had ordered an ultrasound of the right side of my abdomen, so that included my liver, gallbladder, and my right kidney. Again, the pain I was having was on my lower back on my left side. And on the ultrasound, it showed that I did have gallstones. So based on that, I was recommended to go see a general surgeon to have my gallbladder removed. And the surgeon said, yeah, the gallstones, they can cause pain. You might notice the pain after eating like a fatty meal. That wasn't something I really noticed, but I did know that I was having terrible pain. So I said, yeah, okay, we'll go ahead and have my gallbladder taken out. So I had that surgery in late February, and not even a week after the surgery, the pain came back. So, and I had the pain twice in 1 week in March. So I went to the emergency room, and the emergency room doctor said, you know, the emergency room isn't for this kind of thing. You should be going to your primary care doctor for back pain like this. This isn't an emergency. And I said, you know, I have been to my primary care. I've been to rheumatologist, chiropractor, physical therapy. I've done everything I can think of. I'm just here because I am sick of having pain like this and I need some kind of help. And the emergency doctor, she said, okay, well, I don't think it's gonna find anything, but I'll go ahead and do a CT since you're here. And so I did the CT, and it came back that my kidney was swollen, my left kidney was swollen due to a blockage from the kidney to my ureter, so the urine wasn't draining to the bladder like it should. So that was causing my kidney to swell, and that was what's causing the pain. So they finally got to the bottom of what it was, and it was just such a relief. I remember like crying on the way home from the emergency room because it was fine. I finally like validated what was going on, because all these doctors had basically just said like, get over it. But I knew that this pain was something other than that. So I learned a lot in that experience. Like, first and foremost, like, if you're having pain, don't ignore that pain, and don't let anyone else tell you to ignore it either. Keep following up, keep asking questions, keep doing like the next thing. And if you can get any diagnostic tests, do those tests. No matter how frustrated you are with the doctor, keep doing those tests. If a doctor says no to you, have them document that. Say, you know, can you put in my chart that you said we wouldn't do this? That can be helpful to come back to later. But just keep asking and keep following up. And then also recognize that it is on you, the patient, to kind of bring stuff together, because I found that a lot of doctors are super specialized now, and it seems like that can lead them to not consider something else that could be going on. Like, the general surgeon takes out gallbladders every day, so he might see gallstones and think that that's the cause. The physical therapists, they see a muscle thing that they can work on. The chiropractor does that. So there's just all these different specialties, and I see it as my job to bring everything together, to think of different ideas on what it could be. So that's a big thing I've learned, is just to speak up for myself and to advocate for myself in that way, since it's ultimately me that has to deal with whatever the consequences are. And I've learned to carry this over to the IVF process too, because it is a long-term relationship with this clinic, especially doing the donor egg, because that's just a whole other step they have to work with the clinic on. And so it's been important to me and helpful to me to keep up that communication and just not be afraid to contact them, afraid to ask questions. I keep reminders for myself to keep in regular communication, to make sure that I'm not missing anything with them, they're not missing anything with me, because it's ultimately the highest priority for me, and to get everything taken care of. I know that this is their business, this is their job, but I believe that the squeaky wheel gets the grease, so I'm willing to be that squeaky wheel if that means getting any higher results or faster response from the clinic. I'm willing to go make the extra effort to keep in more consistent communication with them. And then on my part, to make that communication better for everyone, I keep a contact list of people at the clinic, because there's several different sides to their clinic and business there. So keep a list of everyone's name, what their job title is, what I should be contacting them about, what their extension is, their email address, everything. So I find phone calls can be super effective. You can wrap up a lot more stuff on a phone call than you can in an email. But I also find it nice after a phone call to kind of recap what we talked about, to get that in understanding. Or if I leave a voice message, to leave a follow-up email, just to catch people, because I think that phone calls are like the best for communication wise. It's the closest thing to face-to-face communication. But also a lot of people check their email or what have you before they check their voicemail, or they might be able to do 100 emails in a day, but only 5 phone calls. So just whatever way I can get in communication is awesome. So I just like to over communicate rather than under communicate, and I've just learned to stop being afraid of asking questions or being annoying or whatever, because I'm the patient, I'm the one that they're here to help, especially in the IVF realm, but in any medical circumstance, that's what the doctors are there to do, and I've just learned not to be nervous about that. So I really hope that somebody found something in my story or my advice helpful. I'd love it if you could like, comment, and subscribe, and thank you so much for following along with me.